If your activities have been limited, or you have shortness of breath due to a chronic pulmonary condition such as COPD, chronic bronchitis, emphysema, pulmonary fibrosis, cystic fibrosis, or chronic asthma, you may benefit from pulmonary rehabilitation. Pulmonary rehab is a program designed to help you improve your ability to perform daily activities such as walking, stair climbing, and getting dressed. You'll also be taught breathing techniques to help you control your shortness of breath and get you active again.
A supervised exercise program is important so that you progress appropriately and don't go beyond your limitations. We have specialized equipment and monitor your heart rate, oxygen levels, and blood pressure so that you can exercise safely. In addition, we'll provide you with a home exercise program and instruct you in breathing techniques so that you can continue to progress. After you've finished our program, we will transition you to an independent exercise program so that you can continue to make improvements. It's a short-term investment that can provide you with lifelong benefits.
My lungs are scarred very badly, especially in the top portion. They said it's incurable, and they don't know the cause. It's an unknown cause. It prevents me from breathing right. If I get anxious or stressed or strained any kind of way, I'll start coughing, and I have a hard time breathing. Even when I'm talking, my speech will break up on me a lot. But when they started doing the working with me, I did start noticing a difference, because beforehand I had I guess I may have just kind of given into it a little bit. They started working with me here, and I found a little incentive to keep going. My strength, physically, I feel like I've got a little more energy. It's made me more energetic. People here have been really great as far as motivational purpose is concerned, and yeah, I'll continue as long as they feel that there's a chance of improvement with me.
When I was 4, I had a whooping cough, and what it did, it collapsed my lungs, and that was in the 50s, and it damaged them. Because I'm getting older, started to get more infections. I've got a lot of scar tissue there. I've got some emphysema. Every time you have a lung infection, then it causes more damage. This center has taught me what to do to help me get, as well as I can possibly can. And they've shown me exercises I could do, which I really couldn't do. With the walking, it's very, very important.
During your first pulmonary rehab visit, the therapist will discuss your medical history, check your blood pressure, heart rate, oxygen saturation level, and your respiratory rate. We will also examine your strength, flexibility, and your walking tolerance. We check your walking tolerance by measuring the distance you're able to walk in 6 minutes. If you need supplemental oxygen, we have that available in the clinic. We will then discuss goals for you to work towards. Typical goals include increasing your walking tolerance, improving your ability to climb stairs, and increasing your strength so that you can do your daily activities with less difficulty and less shortness of breath. You will then begin monitored exercise training to improve your endurance and strength.
In addition to exercising, you'll be instructed in breathing exercises that will help you breathe easier and manage your shortness of breath. Some of those things may include diaphragmatic breathing and pursed lip breathing. We will review the use of supplemental oxygen with you if necessary, and you will also learn about pacing, conserving your energy, exercise, and activity guidelines. Each session typically lasts about an hour. Most patients come through the pulmonary rehab program, attend therapy 2 to 3 times a week for about 6 weeks. It's important that you come to your scheduled appointments so you can get the most out of your therapy, as well as do the exercises that we teach you to continue with at home. In order to improve your endurance, strength, and breathing, you need to exercise on a regular basis.
So how do you get started in the pulmonary program? Let your doctor know that you're interested in pulmonary rehabilitation. This program is covered by most insurances. For additional information, visit Sentara.com, the National Institute of Health, or yourlunghealth.org.